This conference will now be recorded.
So yesterday we just had an overview of benefits. We didn't discuss much. And today we are going to start actual configuration. For that, let me help you. So actually, these are my client requirements. Um, we have created a number of plans for different insurance, healthcare, retirement, additional plans. And my client is Austin specific. Of course, we will also create US specific plans as well. Okay, US specific plans like spending account and healthcare coverages. Those also will create. And as part of our regular session, once we create one plan, for example, if I created additional plan, okay, if I create one plan, one coverage type plan, I'm going to give you 3 to 5 plans for your practice. This is our real-time requirement document. This is how we will gather the details from the client. Based on that, we have to configure the data. Okay.
Here, may I ask, can you just give me just really brief overview? I know, I mean, in benefits, all the insurance and everything is covered.
Right. Sure, Manisha. We can do that. So, Manisha, actually in Workday, the benefits are classified into 6 types. Okay, the benefits are classified into 6 types. So, if you can go to the tenant, one of the crucial role of the consultant is identifying the right benefit plan and the right coverage type. So, okay, there are 6 coverage types we have: healthcare coverage type, health savings account coverage types, spending account coverage types, insurance, retirement additional. These two health savings account coverage types, spending account coverage types are unique for United States of America. For example, they have a flexible spending account. It has both Medicare and what is that? Same health savings account. So for those only, we have two additional uh, coverage types. So rest of the countries, we can use all the other options. Okay. So
Mm-hmm.
we have a components in Workday. In order to create a benefit plan, we can't directly jump in and create the benefit plan. We have a set of process, set of prerequisites. We have to follow that process. Like first create coverage type, define the coverage. Then after create benefit group. Then after create worker plan eligibility applicable. Then benefit plan or frequencies. So we have a sequence of steps where we have to follow in order to configure the plans. Okay, so yeah, yesterday we discussed all this much, not much.
Okay.
And today we're going to talk in detail. So what is mean by coverage type, why it is prerequisite, all the details we will discuss in detail in today's session.
Okay. So
Let's
we are
start.
doing healthcare coverage today, or it's just general we are talking?
Uh, so we will create additional benefit plan first. Okay, additional benefit plan is very easy. So if you can start insurance or flexi, it will be a little tricky to understand because it demands rates, it demands some additional information. Let's start with the easy topic
Okay.
so that you first understand the concepts. So Arun, is that okay? We can start with an easy concept.
Sure, no worries.
Thank you, sir. Okay. So let's see this requirement. Ignore this pairs and division. Okay, these are client specific. Also the last 3 rows. And I can replace this to USA. So Arjun, we are creating a plan called health assessment. Okay, health assessment mail. First, let's understand the plan first, what it is. We have to understand the client. So most of the organization nowadays, for those employees, yearly once they're giving some health checkup benefit. Health checkup benefit yearly once. Even my organization also providing. So the employee can go to any of the hospital, any one of the hospital associated with the organization. Any one of the hospital they can go and they can do their health checkup. So what are the health checkup cost? Say let's say $100 or $200 or $500, whatever it is, the company is going to pay for that. Okay, benefit provider is directly the company. Benefit provider directly the company or some third party vendors as well. For example, Bupa. Okay, third party vendors as well. And who is going to claim the amount? Employee. Beneficiary is employee. Okay. So now again I'm explaining the same. Three terminology we used to remember here. One is provider, benefit provider, employer, employee. Provider, employer, employee. Employer will offer benefits to an employee for the services of from the employee. Employer will offer benefits to an employee for the services. Then employee can claim the benefits directly from the provider. Employee can claim the benefit directly from the provider. Employer will take care of the expenses, whatever it is. Okay. So some plans where both employer and employee also needs to be contribute. For example, healthcare and insurance. Both employer and employee also needs to be contribute. Retirement savings, one of the very good example. Retirement savings. Employee will contribute some amount. Employee also contributes some amount. Some benefit plans where only the employer will contribute, not the employee. For example, this health assessment. Okay. Let's see how to create this plan. So what are the components required in order to create the plan? Before that, let me explain what details we need to capture from the client. Ignore these two. This is our phase 2 requirements. So we are implementing this plan for United States of America. Okay, for USA we are implementing this plan, and this is a plan reference ID as per our design. This is our plan reference ID, and this is the deduction code which is given by the payroll team, so that they are going to take this amount. Okay, payroll team has been given, and this is the provider who is going to offer this health assessment test, and this is a coverage type, health assessment mail, and this plan should be available in the system. This you can ignore. This is our client internal thing. I can give the start date here manually. Let's say this plan should be available from 1/1900. 1/1900. Plan should be available from 1/1900. Coverage target not required, because additional plans doesn't need any coverage target. What is meant by coverage target means who is going to be covered for this plan? Dependents, when it's a dependent, spouse, children, etc. Right? Are there going to coverage for this plan? No. Okay, that's what we have given as N. No dependents are eligible for this plan, only the employee. The plan behavior amount is an amount based or percentage based. What is it? No, amount based plan. An employee can select only one election under this coverage. It's true. A coverage can hold multiple plans. A coverage can hold multiple plans. For example, let's say remove the mail here. Assume our coverage is health assessment. Under this health assessment, you can create multiple benefit plans. Health assessment male, health assessment female. Okay, so one coverage type, under that we have two plans. Now here we are asking, is it one election or the employee can take both the plans? one election only. It's one election. Okay. So for that we have this function true. Must at coverage. Is it mandatory where employee needs to select? Is it mandatory employee needs to be select? Yes, it's a mandatory. Must employee has to choose this plan, either one of the plan. The coverage should be applied from plan year end date. Okay, or coverage is applicable from the start date itself. Okay, one question. Let's say you are an employer. You hire an employee with effective date of starting date today. Are you going to give the healthcare benefit right away to that employee? No, right? Some organizations are not going to give. Employee has to complete at least wait till year end. Correct? Then only next year the employee can take this benefit. So this is coverage plan from year end, not from start date. What is the benefit plan name? Okay, who are all eligible for this? I'm going to change this to United States, USA, and FTC means we have department, so I will remove. We'll say USA and permanent employees. Okay, all USA permanent employees are eligible. Okay, and see the criteria under age of 40. Again, they're saying age of 40. This is again a little tricky. So, okay, let's create. I hope you guys can understand easily. Then this is a plan eligibility. So all US employees permanent, but their age should be less than 40. It should not be more than 40. Then only they're eligible for this. Auto enroll. Auto enroll means you're forcing an employee to take this plan. You're forcing this employee to take this plan. Is it true? No. We should not force the employee to avail this plan. Auto enroll equal to no. N means no, Y means yes. Use individual rates. Yesterday we discussed use individual rates. For example, you are not capturing the amount details at plan level. You want to populate that amount details directly from external system. For example, your client is Walmart. Your client is Walmart, and Walmart has P2Soft. Also, Walmart has Workday. What Walmart has done, they are already managing and maintaining the benefit plans in the PeopleSoft. They're already managing and maintain the benefit plans in the PeopleSoft. But most of the worker history and everything they're going to generate from Workday. So what they said, you create the benefit plans in Workday also. Create benefit plans in Workday, but don't maintain the amounts here. Take the amount from PeopleSoft to Workday. Take the amount from PeopleSoft to Workday. If we have such requirements, then only the individual rates will come into the picture. Where client has bringing that information from the vendor or from external system into the Workday, then only the managed individual rate should be true. Currently we are saying no, which means we are managing and maintaining the rates within the Workday. If it's true means you're bringing those amount details for each employee from external system. Okay. The rates can be reset. No, the rates are fixed. It can't be override or reset. So what is the currency? We're implementing for USD, USA, so currency would be USD. What is the frequency? At what frequency the employee needs to be paid? Monthly basis. Some amount needs to be deducted from the employee. Monthly basis. Is a benefit group for rates? All employees in USA, same eligibility. The benefit group also remains same. Okay. Who are all covers for this plan? Okay, please this one ignore. This is a question. I will overwrite to employee. Actually, the plan is for. I'm sorry. Employee only has to be enrolled. Okay. Then after, what is the employee cost? Rate. What is the employee pre-tax employee cost? They're not giving. But let me say one thing. Employees paying employee cost. Employees paying very minimum charge of $10, or let's say $5 per month. Okay, this you can ignore is our comments while we get in the details from the client. We asked you to provide some inputs. Now, I request both, please go through this and ask me if you have any questions on this requirement first.
I just have a question on this. When we say additional,
Did
Hey, hi,
hello,
Simplice.
les policiers qui aiment souvent frapper sur les
hello.
Yeah, please go ahead.
Yes, I had question on that column G. It says additional benefit coverage type. It says health assessment, and again in benefit plan name, that I understand it's a health assessment plan, but what is this additional benefit coverage type then?
Okay, that's I'm coming to that. I'm coming to that. So as I said, we have 6 coverage types we have, correct?
Right.
Here we have to create that coverage type. I already helped the client. Once I got the details, I identified this benefit plan should be configured under additional. It's not retirement, not health under. Okay. Okay, might be you might confused. Hey, Kiran, we are saying is healthcare. Why can't we create under healthcare plan? Correct.
Yes.
Right. This is the confusion in the benefits commonly. So let me help you, man. Healthcare plans are different. This is the yearly ones where employee is paying minimum, employer is giving. And this is not a this is healthcare plans means if the employee is in severe risk, like short disability or full
Oh,
disability, or employee death cause, that kind of benefits will configure on healthcare. And this is just a regular health checkup, correct?
okay. Okay. Once a year checkup.
Yes.
Okay.
Yeah. Okay. Hi, Simplice. Let me give some heads up. So today we come with some requirement. We are just walking through this requirement. I request you go through this all the tabs except these two and last three, and please ask any questions if you have before we move ahead to configure this plan. Arun sir, is it clear?
Kiran.
Okay. So shall we configure this plan? Now you may ask more questions while configuring the plan. Please feel free to ask. So I'm giving some heads up. So this plan we are creating for United States of America and employees who is permanent and within US. Also the age should be less than 40 years. Then only they're eligible for this plan. Okay. And this plan employee is going to pay very minimum amount, $5 per annum. And what is the purpose of this plan is employee can avail healthcare checkup on yearly basis, and the provider is Bupa. Okay, let's go ahead and create it. So now let's talk about the component. So far we have this requirement. Now in order to create the plan, what details we need first? Let's see the components. The first one we need benefit coverage type. Okay, first thing we need benefit coverage type. Then benefit provider. Then we need benefit group, and we have additional requirement worker plan eligibility also. So worker plan eligibility rule. So these are the minimum things we need. Now let's configure one after another. The first thing, benefit coverage type. So go to the task, maintain benefit coverage types. You will arrive here. Maintain benefit coverage types. And we decided to create this plan under additional benefit coverage. All right. Already this is GMS standard, so we have some default data. Now let's create a plan. Coverage type. Select the arrow button and provide the name. I'm going to give it as AMD too easy to identify. So what is the coverage type name? I will remove this gender one, health assessment. Okay, health assessment. Plan behavior. Are you going to select the rate, its accepts amount or percentage? We have these options. I think also yesterday you have asked, can we populate percentages as well? So for retirement, you see, the automatically it will be default into percentage amount. If you want, we can populate it. I'm giving it as directly $5, so I'm saying amounts.
Okay, thank you.
Okay, no problem. So here is a very good feature. Recently, Workday has given this. So they uploaded some badges. Okay, they uploaded some badges. I think in Workday 30. Sorry, Workday 30, they have given these features. You can select one of the options. So our plan is health assessment. Which one will select? Which is most
The heart
feasible?
and hand.
Health
And hand.
support. Yeah.
Yeah.
Good. Okay, heart and hand. So that it will be displayed to the workers. Okay. Now only one election. What is our requirement? Only one election is true or false. It's true. What means only one election? Under one coverage type, you can create a bunch of plans. On one cover under this coverage type, you can get bunch of plans. Are you going to allow them to select only one plan or multiple plans? I'm going to allow only one plan. So I select this checkbox. Must select coverage. Is it a must select coverage? Is mandatory? Yes. Select this checkbox. They have to elect this plan. Okay, mandatory. Now, okay, let me explain this. Display employee cost, display employer contribution. If you would like to allow your employee to view how much the employee is contributing, select this checkbox. If you want to allow how much the employer is contributing, select this checkbox. Okay, in our requirement, employee is giving nominal fee but not the employer, so unselect it. So employee must see how much they are contributing. Okay. Use coverage from plan year end date. This coverage should start plan year end date, not on the start date. Obviously, when you hire an employee, you are not going to give this plan immediately. You may ask the employee to stay for an year. At the year end onward, that employee is eligible for the plan. If that is the case, select the checkbox so that the employee cannot select the plan right away. Okay. So what is our requirement demands? It's true. Use coverage from plan year end date. Okay. So Cobra, what is Cobra? It's specific to US. Anyone? Consolidated Omnibus Budget Reconciliation Act. Consolidated Omnibus Budget Reconciliation Act. So what it says, in US, due to few reasons, if employee death or company went bankrupt or employer terminated the employee without any proper reason, then the employer is liable to take care of the employee health care issues. Employer has to take care of employees health, what do you call, payments. Healthcare things the employer has to take, either one of the reason. If the death, then the employer has to take care of the dependents. If the employer went bankrupt, then the employer has to take care of employees health for not more than 6 months. or employer terminate the employee without any good reason, then the employer has to pay a health care benefits to an employee till 6 months. This is mandated in the United States of America. If this plan falls under COBRA, then select this checkbox so that you can grant the COBRA. This is a different concept we'll discuss. Okay, actually this falls here in healthcare. Here it will fall. Ignore here. We'll discuss in the next topic. This way we can create our healthcare coverage type. Any questions here on our AMD? Okay, yeah, display order. So sometimes what happens, an employee might, as I said, one coverage type might have 10 benefit plans. Okay, which coverage type should display first? You can give an order for that. Okay, I can give one. You can give the same number, there is no harm. So any questions here on this benefit coverage type?
Can you please explain display order again?
Sure, ma'am. So what happens whenever you assign the benefit plans, an employee might be eligible for additional benefit, employee might be eligible for insurance, employee might be eligible for health savings. In additional, okay, let's take this example. Employee might be eligible for 3 types of additional benefit coverage types. These 3. Okay. So which one you want to display first? This one, or this one? So you can giving the order, display order. So if you give first means this is going to be visible first. Okay, in real time we are not going to maintain the same frequency. We'll defer it. But this is a GMS tenant, so I'm giving the same order again.
Okay.
Okay, so let me save it. This is the first one coverage type we have to configure. We have configured our coverage type. Then create provider. Who is going to provide this benefit? Bupa. Okay, Bupa is going to provide this benefit. I believe this is already available in the system, but slightly I will replace the name. So access the task, create benefit provider. Create benefit provider. Input the effective date 1/1/2019. I'm sorry, we agreed to go with 1/1. Always when you're working on the benefit plans, okay, use this date, all the plans, so that the all plans will be in sync. I will tell you why we have to use this date later. So name of our provider Bupa. So that name already exists. So I will give Bupa MD. So it is easy to identify.
This will always be in the demo tenant, right?
Right.
Date
But
1900.
Europe and UK is was ruled by Bupa. Yeah.
Okay.
So if there is an URL for this provider where you want to allow your employers to go through this list of instructions by the provider, you can copy paste it here. Create external URL. Bupa. And then give here https /bupa.com. So what happens? Normally we have to ask the provider to give, for example, you're giving health savings, where the health savings accounts has health screening instructions has been maintained the Bupa. That URL we have to give it here. So that what happens? Whenever the employee wants to go to that instructions, they will select this. It will take you to the Bupa website. The employee will go through that. Okay, the provider ID type. So if there is any provider ID type, we can give it here. For example, we'll give the ID. Okay. So provider ID type means each provider has a unique reference number. Benefit provider. Okay, that ID types is not enabled in the current system. That's why it's blank. But anyhow, we are not going to use it just for reporting. No worry. Provider ID. You can give a unique ID in the Workday system for each provider, and this is what we have given for this person. Identification number, tax identification number, TIN number. So this provider might have some TIN number. That number we have to capture here. Okay. Electronic signature, for time being, please ignore. I will explain in another session, coming session. First, let's create the plan. Then after, I will explain electronic signature and instructions. Available plans are empty because we have not assigned this one to any plan. That's why it's just blank. And this address is, you can give one of the address if you want. Normally in real time, we'll just create this name and the URL. Okay, simple one. Provider details we have created. Next one. So provider we have created, coverage type we have created, and then excuse me, benefit group. Where is that benefit group? Okay, so benefit group. Oh no, it's group right. Benefit group we have to create. So let's create benefit group and worker plan eligibility. These are the important things. Worker plan eligibility rule and benefit group. Components we are creating individually now. Now we have to group those components later into the plan. So first create benefit group. Sorry, benefit group. Sorry. Access as benefit eligibility rule first, and here you have a checkbox called benefit group eligibility rule. Okay, benefit group eligibility rule. Select the checkbox. Create benefit plan and benefit eligibility rule. Under that, benefit group eligibility rule. Okay. Provide the name. So first, I'm creating a group AMD country USA. So we are going to create this eligibility rule based on the country. One second, location country also. We have n number of fields while creating this. So, okay. In the selection list, USA. Okay, add row button. So can anyone tell me why we are selecting here active employees? What happens if you're not giving active employees?
It'll even assign the plan to the inactive or the separated employees.
Right, sir. So active means the employee is working in the organization. So if you're not giving this, what happens? Workday will let you allow to assign the plans to terminated employees also. Terminated employees means not post future. If, for example, you have terminated employee with effective data, December 2009, December 1st, 2019, which means termination action is already given in the tenant. He is in serving in notice period. So when you select active means it will put filter only on active workers, not terminate. It will exclude that terminated employees. Okay, that's why it's mandatory to include active employees also here. Location country United States of America, active employees equal to this. This is benefit group. Okay, the one we created is benefit group. Now our client also asking us to create a worker plan eligibility rule. Okay, worker plan eligibility rule. What they're saying, all employees in USA plus permanent plus worker age should not be greater than or equal to 40. So this eligibility rule also we have to create. Let's see how to create this. Access the same task again, create benefit eligibility. Benefit plan eligibility this time. Okay, benefit plan eligibility. Equal to USA and employee should be permanent and less than age should be 40. Now we have to build this eligibility rule again. Location, country. Actually, we can skip this location country. That's not a problem because we already given the group. But it's good for practice. So when you select permanent, what is the field we have to select here? Which field we have to select? Employee type. Oh, we don't have permanent here.
We do regular.
Yeah, we can replace it. I will select regular. Permanent is nothing but regular. In that tenant, we have created permanent instead of regular. So in this tenant is regular. I will replace it. Then select add row button again. What is the other one? Age criteria also they are saying. Less than or equal to 40. Oh, sorry. Okay, 40. Right? Then select OK. So we have created the eligibility rule, benefit group as well. Correct? I mean benefit group eligibility rule and worker plan eligibility rule also we have created. Then create benefit group now. Benefit group eligibility is different. Benefit group is different. Create benefit group. I think, sorry, in the first session itself, I'm taking more. 90. So benefit group name.
In this, we are not giving 1900.
Oh yes, thanks for reminding that, Manisha. Thank you. Or else everything will go. Yeah. Okay, group eligibility just now we created, right? So AMD country USA, assign the group eligibility rule here. Okay, enrollment event rule. For timing, I'll set the existing one. The later I will change the enrollment event rule. Initial enrollment event rule, the Workday delivered one I'm selecting. Later we will create the new enrollment event rule. Okay. Waiting period calculator order. For timing, please ignore. This we will discuss in our healthcare. Waiting period, grace period, what does it mean? Or expiration rules. Frequency per month. Currency, this is for US employees, so give USD. Okay. And this is for spending account, USA specific. Okay, USA specific. So ignore. And once we're creating our healthcare plan, I will explain that. Calculate as of, from calculate year begin or event date or specific date. So calendar year begin means it doesn't take care of high dates, etc. Calendar year begin means from Jan to December. From Jan onwards, it's going to be calculated. Employee age calculation. Okay. Event date means from the day you assign the plan, from there onwards, it's going to be calculated employee age, 40 years or what. Specific date means you have to specify the specific month, specific date. Okay. But here automatically we are going to calculate. So select calendar year begin date. So automatically it's going to be calculated from 2019 first for current year. And again, I will explain this one. So as I said, ignore a few things because at this stage, these are not required. Please hold on this. So benefit credits plan mappings, once you assign the plan, it will be defaulted. So ignore, automatically it will be defaulted. Okay. The few minimum details, mandatory fields I have given here. Now let's summarize. Benefit coverage type we have created. Benefit group we have created. Benefit group eligibility rule we have created. Benefit provider we have created. Worker plan eligibility rule also we have created. Then now create the benefit plan. Create benefit plan. Whatever we are creating are groups. Let's call it as, components. In order to create the plan, we need components. Okay. 1900 provider. We created our provider AMD Bupa. Plan type. We are saying this is part of additional benefit plan. Select benefit, additional benefit plan. Now it will ask you the coverage type. We already created a coverage called AMD health assessment. Select it. Hit OK. Now see what are the parameters. Effective date. In order to create a plan, this is an interview specific question who's are preparing. In order to create the benefit plan, what are the prerequisites we need? Effective date, provider, plan type, coverage type. Hit OK. Now here provide the plan name. Or if you're not giving any plan name is also fine. This will be default as a plan name. Ignore the plan name. That's okay. Description, who are all eligible for this plan? If you want to give, you can give. External plan description means if you are managing this plan from the external vendors or external systems, and if you want to bring those results into this Workday, you can give it here. So ignore, we don't have that one. Group policy numbers. So sometimes organization will take group policies for all the employees. If you have such policy numbers, you can input here. Okay, let's ignore. This is applicable for insurance plans. Participating benefit group. We have created our benefit group. Assign the group here. Worker plan eligibility rule also we have created. Assign it, the worker plan eligibility rule. This time. Now you may ask the question, hey Kiran, what is the group? What is the plan eligibility? Group means you're grouping all the employees based on the country. And further level filter you're applying based on this. All employees in USA is eligible, but they should be active. That's what we're saying here. And here we are saying employee should be USA, but employee must be permanent and less than equal to 40 years. Then only eligible for the plan. That we are giving it the plan eligibility. Okay. Then employee cost is pre-tax or post-tax. So what is the difference between pre-tax and post-tax? Anyone?
Pre-tax is if your salary is 5,000 and it'll pay before you pay the tax. If otherwise post-tax is you pay 5,000 tax 1,000 and then you'll be paid from there.
Right. Pre-tax is these terminals we have to use. Please Google for more information. Pre-tax is employee friendly. Okay, pre-tax is employee friendly. What happens in the pre-tax? before tax calculation itself, what are the contribution is there that will be deducted, and whatever the after pre-tax amount, that on that amount only the tax going to be calculated. So employee saved some of the amount from the tax. If it's a pre-tax, select this option. It's a health, so let's save it pre-tax. Auto enroll is not an auto enroll, so ignore this one. Use individual rates, we are not bringing those results from external system. Okay, so ignore this one. Currency is USD. Okay, frequency every month. Employee has to pay $5. The benefit group here will be by default is available. The one we assigned or created. Assign that group and employee amount minimum 5, maximum $10. In between, employee can pay any amount. Okay, earnings and deductions is nothing but if you're bringing this benefit into the payroll, we have to assign the earnings and deduction codes here. This I will explain in coming session. So any questions here? So let's see once I save the record how it looks. Please remember we are not giving any name. Let's see the name how it defaulted. Okay, the coverage type acts as a name if you're not giving any plan name. So any questions here on how to create a benefit plan and what are the components? I mean, once you do practice, then it will be, I think, right? We just created. Then again, further, we have to create a reason. That is nothing but an event. Then we have to assign this plan under enrollment event rule. Then we have to include this plan in the plan year definition. Then we can go ahead and assign the plan to the worker. So we have to follow the sequence. I'm planning to hold for now. I don't want to discuss more. You guys might be in conflict with the first session. So tomorrow we'll create an event. We'll also assign enrollment event rule, plan year definition, and we'll assign to the worker. Okay. Any questions? Are it clear?
No questions. No.
Yeah.
Okay, maybe once you guys do practice, if you have any questions, please make a note. Tomorrow we'll spend more time to understand again.
Kiran, would it be possible to talk just for a few minutes after the class?
Sure, Manisha, not a problem. Yeah. Okay. So Arun, I mean, if you have any questions, I will just talk to Manisha if you're okay. Simplex.
Sure, I can.
Yes, thank you, sir. Hi, Simplex. Hi, Simplex. Can you hear me? Okay.
Okay, I'm dropping off. Thank you, Kiran. I'll talk to you tomorrow.
Thank you, sir. Take care. Take care.
Thanks. Bye.
Bye. Hi, Ray, can you please hold the recording? Hello.
Hello.
Manisha is still on recording, so it will share with everyone.
Okay, okay, okay.
Seems no response. Okay, or else I will do one thing. I will message you through
Okay.
email.
Sure,
Thank
sure.
you.
I just wanted to know about the advanced compensation. That's all.
Right. Sure, no
Yeah.
problem.
Okay.
Hey, thanks, please. Thanks for your time. Thanks, Manisha.
Thank you. Good night.